Are there any life-threatening diseases that are caused by shock? Many people are of the opinion that all life-threatening diseases are caused by accidents and other shocks to the system. There is absolutely no truth to this view. The shock itself is not a life-threatening condition, but it can certainly affect your ability to live a healthy life. Here's how shock can kill. When you are under the influence of shock, your body will not respond as it should to your commands or if you try to fight it. This can be compared to someone in a car who doesn't know how to drive. Even though he or she is experienced driving, the car may crash or slip out of control and cause an accident. Other symptoms of being shocked include fainting, loss of consciousness, choking, unconsciousness, and heart attack. If you have any one of these symptoms, then you probably were shocked. These are dangerous diseases that can be fatal without proper medical care and attention. They can cause permanent damage to the body. Can you survive a shock? Yes, you can survive a shock. If you have no particular fear or illness, you can go on living after experiencing a shock. However, if you do have a very serious problem, such as choking, loss of consciousness, accident, then it is best that you go to hospital for treatment immediately. Shock treatments take several hours or even days. Are there any life-threatening diseases that are caused by shock? The symptoms of a shock can include shortness of breath, heart attack, irregular heartbeat, convulsions, choking, and permanent damage to the body. If you suffer from any of these symptoms, then you need to see a doctor right away. Don't put it off. Shock treatments are used for a wide variety of dangerous diseases. They are often given to people who have acquired a severe infection from a bug or spider, or have been in extreme shock after having a major surgery. Sometimes, they are given to people with cancer, whose body has begun to reject normal cells, or to people who suffer brain damage after being hit by a car. In some cases, they are given to people suffering from a disease that they actually have, but just want to have it cured so that they won't be a burden to their family or friends. Some of these drugs are given to children, who have problems with their digestive systems, as well as those with kidney and liver problems. Shock treatments usually don't last very long. The person is placed under anesthesia and then off to sleep. When they wake up, the medicine has already been absorbed by the body. Although this sounds like a quick fix for a problem that could easily be cured with natural medicine, the truth is that many of these drugs are too strong for the human body to handle, and they can cause side effects that can be fatal. When it comes to the question of, are there any life-threatening diseases that are caused by shock? The answer is yes. If you have had a major operation or have had cancer surgery, you could very well develop a dependency upon the drugs. They can cause nausea, vomiting, diarrhea, headaches, flu symptoms, and a host of other issues. It is very important that you ask your doctor about the medicines that you are taking, and if you notice any symptoms of overdose or addiction. In general, the answer to, are there any life-threatening diseases that are caused by shock? Is yes, because so many different drugs can have side effects that are both severe and potentially fatal. You need to check with your doctor on the various drugs that you are currently taking, and ask him or her about any medicines that you had been taking in the past. The last thing you want is for a life-threatening disease to take hold of you because you did not know about the potential dangers. There are several medical conditions that can be caused by a shock to the system. These include pulmonary embolism, stroke, and heart attack. There have also been reports of coma, convulsions, respiratory arrest, and other symptoms that can occur when a person is in shock. If you think you may be at risk for one of these, you should see your doctor immediately, so that he or she can make an accurate diagnosis and prescribe the right medication. Yes, if someone is having a heart attack, coma, or a stroke while on the drug of abuse, then it is definitely a dangerous disease. The question remains, are there any life-threatening diseases that are caused by drugs? One of the best ways to curb this problem is through education, so the next time you are prescribed any type of drug, you will not automatically think that it is the wrong one. Instead, you will realize that it is a medicine that is meant to treat your ailment, and not to become a lethal weapon.